All right, CTV's host of Question Period and Power Play, Evan Solomon, is standing by in Ottawa with more on the takeaway from some of those numbers. Evan, surprising, not surprising? What do you think?
I think most Canadians would be a little stunned that between March 31st and November 12th, 6.58 million people crossed the border. Not that we didn't think that there was lots of truckers and essential workers. That's a big number, Todd. So on one hand, this is not about the truckers. They're doing unbelievable work. We should take our hats off and thank them. They're keeping our store shelves filled and they're doing phenomenal work. And who qualifies as an essential worker? Well, all those folks that need to cross the border, that's great. Here's the stunner. Not that over 50% are truckers, not that 80% never even had to quarantine. It's that we have no idea because there is no tracing. Let me just give you an example. If you go to a restaurant in Toronto where you're living right now, or if I go to one in Ottawa, they say, thanks, here's your table. Can you sign in and have your phone number in case someone has COVID and we can contact trace? We hear a lot about contact tracing. Well, all these people are documented because they're designated essential workers, but CBSA and the federal government didn't say, we should have an idea of who's crossing. So we know, so we can trace it. So when they say between 2 and 3% of COVID is being spread by the 6.5 million people who have crossed since March 31st, how do we actually know that? There's no contact tracing being done because we didn't keep any information about it. So, I talked to Dr. Isaac Bogosh, who you know, an infectious disease specialist. He said we should do better on that. It's a miss. And it's a bit stunning that we, for all that time, did not track anybody crossing the border. And there are millions and millions of people. So Canadians are locked down. We're worried about, the circuit breaker and all this. And yet all these essential workers, the millions of them are passing without quarantine. And I'm not talking about the chief executives flying in on private jets. And there's been cases like that who don't quarantine and they get their exemption. That infuriates people. I'm just talking about collecting the basic data, and we didn't do that.
Tell me about that border as well, being closed now until December the 21st. I guess not a big surprise, and we're likely to see that continue well into the new year.
No, I mean, if your neighbor's house is on fire and I told you they're still pouring water on it, you'd say, I hope so. Our neighbor's house is on fire with COVID. Our house is burning as well. There's no way that border can open. We're spiking cases. They're doing significantly worse than us in the United States. And the unfortunate and sad truth is that nobody is surprised that this border is going to remain under this quote-unquote closure except for the essential services, Todd, because, they got to get it under control there. Now, was there a sign of hope today? Yeah, you got Moderna and Pfizer and maybe Johnson & Johnson all talking about very effective potential vaccines. But folks, they've got to be approved by Health Canada. There's a massive distribution issue. And again, a distribution issue is a lot better than an access issue, and we've got access in Canada. But, we still have months and months and months and months and months to go before that's widely distributed and our economies can get back to normal. So that border, Todd, I know they go through this every month. I don't think anybody would be surprised if in 3 weeks they say we're extending it again and again, because just look over that horizon down south. I don't think they're bending the curve yet, unfortunately.
Absolutely not. Hey, good to talk to you, Evan. Thank you.
Thanks, Todd.
Ongoing coverage of this story and the day's top political stories as well. You can catch Evan on Power Play today, 5 o'clock Eastern, 2 Pacific, and again, 8 Eastern, 5 o'clock Pacific on CTV News Channel.